Good afternoon, and welcome to Get Primed for Data Submission via the CMS Portal. My name is Leila Belinsky, and I am a Senior Program Administrator with the New England Quality Innovation Network Quality Improvement Organization, and I'm joined today by Jill Beeman and Anna O'Brien from the Southern New England Practice Transformation Network. And today we'll be going over how to register for an EIDM account and how to do some data submission through the portal. And I'm sure many of you have questions. We will be answering questions at the end. And if you would like to enter them into chat beforehand, we'll also be monitoring chat. As we get started, I just want to let you all know that we are contractors for the Centers for Medicare and Medicaid Services. So this content comes from CMS documentation, but these slides were created by us. Quick overview, as I mentioned, we'll be talking about EIDM account setup. We'll be doing the CMS Portal walkthrough, and then there will be plenty of time for questions and talking about resources towards the end. I'm now going to hand it over to Jill Beeman to introduce herself and start talking about the EIDM accounts.
Great, thanks, Leila. As Leila said, my name is Jill Beeman, and I'm a Quality Improvement Advisor with the Southern New England Practice Transformation Network. So to get started, let's discuss what an EIDM account is. EIDM, or Enterprise Identity Data Management, is the system used by CMS to both submit and access data for the Quality Payment Program in 2017. If you have submitted for the PQRS program in past performance years, this is likely an account you have accessed before. It is important to note that CMS is using the same role naming conventions for QPP that were previously used for PQRS. So now that we know what an EIDM account is, let's discuss who needs an EIDM account. Clinicians and groups who will be submitting data directly to the QPP portal, EHR vendors submitting data on behalf of practices, and clinicians and groups whose data is being submitted by a third party, for example, a qualified clinical data registry or qualified registry, and want to view and monitor their practice data. Here you will see one way to access the CMS portal. If you are a first-time user, you will select the blue New User Registration button shown at the bottom of this screenshot. If you have an existing account, you are able to access your account and establish appropriate roles for your practice, which will be discussed in detail in upcoming slides.
Excuse me, Jill?
Yep.
Could you please speak a little bit louder?
Sure.
Thank you.
If you are creating an account for the first time, your first step will be to choose your application, which in this case is Physician Quality and Value Program. This will prompt you to fill in personal information and establish a username and password. Once your registration is complete, you will receive a confirmation email. The next step will be to select and assign your appropriate role type, and to do this, you will need the information listed under number 2 in this slide. CMS has also created a comprehensive guide which walks through this process step by step, and a link is provided on the slide. In our past slides, we have mentioned account roles. This slide reviews the provider approval role. Once your EIDM account is complete, a provider approval role needs to be requested. If you already have an EIDM account, you will need to confirm there is a provider approval role associated with your practice. Having a provider approval role is required for successful access for you and others in your organization. A provider approval role type also approves additional role type requests. For individual and solo practitioners, the provider approval role is an individual practitioner. For groups, the provider approval role is a security official. The functions associated with each role are listed on this slide. After your provider approver role has been identified, there are additional roles that users can request for your organization. For individual and solo practitioners, you can request the individual practitioner representative role, and for groups, you can select the PQRS submitter and/or web interface submitter role. The functions for each of these three roles are listed on this slide. As was previously mentioned, despite the fact the role types are labeled PQRS, these roles are needed for QPP data submission. Let's touch upon what you should be doing now to ensure a successful data submission for your practice. The first step you should take is to determine if your practice is already registered in EIDM. If you are unsure of whether or not your practice has an account, contact the QPP Help Desk by using the phone number or email listed on this slide. Please be aware that you will need to provide the group TIN and name. If you already know you are registered and have an account login information, log into your account and confirm that all appropriate user roles are up to date. If you do not have an EIDM account, follow the CMS guide to create an account today. Now Leela will walk through how to enter and monitor your practice data on the QPP portal.
Thank you, Jim. So as Jill mentioned, we'll talk about the QPP CMS portal. Once you go onto the qpp.cms.gov website, if you look up in the far right-hand corner, you'll see Sign In. Once you click Sign In, you'll come to this page, and using all of the information that Jill just mentioned in terms of getting an EIDM account will be required in order to sign into the portal. And as you can see here, you'll enter your user ID and the password that you select. After you've entered the correct credentials, you'll come to the CMS Portal account dashboard. I've blacked out some of the information about TIN and NPI information, but at the top you would see your TIN, and it would say account dashboard, and then you can also do help and support. There's a helpful little blurb here saying when the submission window is open. As Jill had mentioned, it's January 2nd through March 31st. So be sure to mark that on your calendars because CMS will not accept any data beyond March 31st of this year. If you are associated with any alternative payment models, and again, this goes back to how your EIDM account was set up, you would see either a 1 or 2 or a 0, depending on how many you're affiliated with. You'd be able to select any of those entities below the APM entity link. If you're affiliated with any practices, you would also see the practices listed below. This individual has 3 practices associated with their EIDM account, and again, as mentioned, I blocked out those TIN numbers, so you can see where that block is, that the TIN would be listed there along with the practice name. Once you've identified the TIN that you'd like to submit data on, you can select on the far right side either 1 if you're submitting data via group, or 2 if you're submitting data for individuals within that practice. Again, this might be your own personal practice if you're a solo clinician, or it might be your group if you're maybe the practice manager or practice administrator submitting on behalf of all of the clinicians within the practice. I'm going to show you what it looks like to report as an individual first. If you select to report as an individual, you will come to this screen where you'll see the practice name and the TIN. You'll also see any clinicians associated with that TIN. So here there's 1 clinician, they're a doctor of podiatry. And then again on the far right side in the red box, you'll be able to select the different category that you would like to submit data for. We'll talk more about what those different submission methods are, but you can select any data submission for the 3 quality measures, advancing care information, or improvement activities. If you choose to submit data for the group, this is the next window you would come to. Very similar to reporting data as an individual, you would see data reporting for the group, and again, you can select quality measures, advancing care information, or improvement activities. The next screen you'll see, regardless of whether you select to report as an individual or as a group will be the same. We're going to talk about quality first. If you decide to submit data through quality, this is not a manual attestation. So you wouldn't be able to manually key in any of the values for the quality measures that you select. You would need to have a report either exported directly from your electronic health record, which would be a QRDA-3 file, or if you're a registry user and your registry can produce a QPP file, you would be able to upload those files. But you must have data in those two file formats in order to be able to upload the file. This portal will not allow any other file types to be uploaded. The really nice thing about the way the portal's been designed is that once you submit the data via the file, the portal will automatically generate a score for you based on the data that's included in the file. So as you can see in this example, the highest score for the quality performance category is 60 points, and this file upload achieved the full 60 points. As you can see below, it says EHR submission summary, maximum 60 quality points have been achieved. If you scroll down a little further on the page, you will see the measures that were scored and the percentage points that they received. If you remember, quality measures are scored on a decile scoring system and is based on the reporting method that you select. So depending on whether you report via EHR report, so again that's a QRDA-3 file, or if you report using the registry, which is a QPP file, the system would automatically score based on the benchmark for each of those methods. In this example, you can see, I'll just quickly talk about how the quality measures are. The antidepressant medication management, that measure received 93.66%, and it received a score of 11 points. So if we go one step further, that measure, as you can see, the 93.66, the second window down that shows you benchmark data shows you that it falls into that 10th decile benchmark group, so that's the most points you could possibly earn. And then because this was an EHR report, you would get the one bonus point for end-to-end EHR reporting, so this measure receives that 11 points. Each of the quality measures that you report on would have the same type of measure score breakdown. So if you're curious on how many points you received or where those points are coming from, you can investigate based on the measures. Next, I'm going to talk about the Advancing Care Information Attestation. So unlike quality, you do have the option of submitting data either manually, so manual attestation, or through a QRDA or QPP file. I know this screen's a little small, but we tried to blow it up. So on the Advancing Care Information main page, as you scroll down doing a manual attestation, you have the option to select the time frame that you're reporting on. So you can select any 90-day window, and you would enter those dates into the time frame. Next, you'll see a little block of text that tells you about the different measure groupings. So depending on the EHR certification year, the tool you're using, you would need to put in the EHR module or system that you're using to find out which measures that you should select. There's a great lookup tool, that's the second box that says need help identifying your electronic health record technology version. It will automatically pull that up, and then based on whatever you select, the three buttons at the bottom, which are the 2017 Advancing Care Information Transition Measures, the Advancing Care Information Measures, or a combination of both, depending on what EHR certification year you have, one or more of those buttons might be grayed out because that's not an option for you to select. So the system's very intuitive in what it allows you to enter or update. Once you've done all of that, say you select the 2017 transition measure set, you would come into the next section of the screen, which would allow you for manual data entry. So as you can see here, the very top pink bar is a kind of continuous running score of how well you're performing within that performance category. Because no data has been entered, the score is currently 0 of 100. Again, you're topped out at 100 points for the Advancing Care Information category. Next, you'll see the measure set that you've selected, so the 2017 Advancing Care Information Transition Measures. And then you move into the actual measures. So there's some information. If you have questions about the actual measure, you can click the little box with an arrow down next to the measure name. So the first measure is prescribing. This would give you specific information on the measure specification, so what's required, what the population is, and things of that nature. And then once you have the information, let's say your numerator denominator is 100 over 200, you would manually key those into the fields on the side with numerator denominator. If the measure is eligible to be part of the performance score, e-prescribing is not, that's why there's an NA, you might see a score show up there, and I'll show you another screenshot that actually shows that. If the measure is eligible for a measure exclusion, such as e-prescribing or the health information exchange and summary of care measures, you would be able to check that box if you're eligible for that exclusion. Some of the other measures are attestation only, which means you simply click yes or no, similar to the security risk analysis shown below. Once you click yes or no, that box will highlight in green. So as I mentioned on the previous screen, if the measure is eligible for a performance score, once you enter a numerator or denominator, you would see in the performance score box a score. So here for the patient-specific education, there's currently 0 of 10 because no score has been entered, but once you enter it, you would see either 10 of 10 or 1 of 10, wherever your performance lands. At the top, as I mentioned, with that running tally of your score, this individual, based on that entry, has already received 82 of a possible 100 points, so they're well on their way to full category performance. Moving on to the bonus portion of the score, if you have additional bonus measures that you would like to report on, you would just, as I mentioned, click yes or no, that you're either reporting on the different registries or that you're utilizing your certified electronic health record technology in an improvement activity. And as you can see, for the syndromic surveillance reporting, this individual said yes, and they received a 5 of 5 bonus points for that portion of the score. They also are using the specialized registry, but since you can only get one bonus of 5 points, they get the NA with a little thumbs up, which means they've met the requirement, but they're not eligible for additional points. Similarly, in the cert used in the improvement activities category, they get the check mark and the full 10 of 10 bonus points. Because of this performance, they've now achieved the full 100 category performance score, and you can see on the side this little trophy that says category success. So you've earned the most possible points and full performance in that category. For improvement activities, these are strictly attestation only. So similar to the advancing care information attestation, you would select the time frame. So again, that's a 90-day window. And then you would be able to search or filter depending on what subcategories or topics you want to attest on those improvement activities. If your EHR can provide you with either the QRDA free file or the QPP file that includes data on the various improvement activities you've selected, you would be able to select that and upload the file automatically. You would click the EHR button here if you're going to do a file upload. Much like the advancing care information attestation, under the improvement activities, you would see again that running tally of your performance along the top screen. And then under each different subcategory, so this is the Achieving Health Equity, there are 4 improvement activities, 0 of 4 have been selected. You also can see the name of the improvement activity, a brief description, and then below in the green and blue, you can see the weight of each of those activities. So engagement of new Medicare patients in follow-up is considered a high-weighted activity, so that earns 20 points, and the leveraging the QCDR is a medium, so that gets 10. So if you selected yes, then you would get whatever the points possible for that activity are. If you're looking to do a data submission through a report upload, there are screens such as this based on the file upload where you can either drag and drop the report right from your desktop, or you can search to upload. Again, it has to be a QRDA3 file coming from your EHR or the QPP file coming from your registry. That was a ton of information. I'm sure you guys all have questions, and I want to make sure that we address those I see some in the chat box, so I'll address those. And Alberta, if you could just remind everyone of how to open the phone line, that would be great.
Thank you, everyone. If you'd like to ask a question, please press #6 over the phone, or you can pose your question in the chat box. We will take as many questions as we can. However, please be assured your questions will not addressed during this webinar. We will make sure someone gets back to you to address your question. Thank you.
So, Jill, I have a question for you. Who does the sign-in, the security official or the PQRS submitter?
Could you read the question again? I'm sorry.
It says, who does the sign-in, the security official or the PQRS submitter?
Could you confirm what they mean by sign-in?
Lucy, if you're still on the call, would you mind providing a little more information on exactly what you're referring to?
Yes.
We'll move on. Oh, okay, go ahead.
Hi, I just heard the question, so I wanted to address it. So I am the security official for our practice, and I have assigned, when we first signed up for the EIDM account, I have a PQRS submitter role. Our EMR vendor is currently signing up so that I could approve them, and they can go in and help us submit some of the data. But should they be signing in under my security official credentials or the PQRS submitter credentials? And will that make a difference as far as how CMS gets the data?
If they sign in under the PQRS submitter role, they are able to view all of the data that your EHR or registry will be submitting on your behalf.
So are you suggesting that they wouldn't see the data if they signed in under my role with me as a security official?
This is Anna, just jumping in. I'm here with Jill. I don't think that they should be signing in under your credentials. I think that the EHR should have their own credentials.
No, they're going to have their own credentials. As I stated earlier, they're in the process of signing up for their own credentials as an EHR vendor. I've already been in contact with the QPP help desk. I'm going to get an approval, a request. Once I approve them, I just didn't know initially. So you're saying they're just going to sign in on with their own credentials, and the data will be available to them just as if they were a submitter for all three of the measures?
Yes, that's my understanding, yes.
And we'll check that with you. Okay, thank you.
So, can I jump in? Can I jump in with a follow-on question?
Sure.
This is Jonathan from the Elliott in Manchester. We have a submitter role left over from PQRS and the security official role, and it said you can report the measures as a security official. And our submitter role person has been out for a while, and we're just wondering whether the security person who's more familiar with it should be doing the reporting. Does it matter whether the submitter or the security official puts it in?
You have to have a security official role in order to have a submitter role. So, like, you can't have a submitter role without the security official role. So if it's one individual within your organization, it would be the security official. If you have subsequent...
Yeah, because they were asking to have a backup security official internally here. Can you have
It really should be one person.
Okay.
Or one login, because you don't want too many people authorizing and approving, and it really should be one individual. You can have as many PQRS submitters as appropriate, but there should be one person that basically oversees the process, and that's the security official.
Okay. And as far as the submitters, does it matter whether the security person puts it in or the submitter puts in the attestation?
No, it does not. As long as they're affiliated with the correct TIN.
Okay. And the only other question is, and this may not be you to answer, but we have two TINs, and we looked and we logged in, and only one TIN was represented, so I put in for the security official to have access to both TINs. Will that cascade to the submitters for both TINs, or does that have to be put in for the submitter as well?
No, it needs to be requested individually.
Okay, thank you.
Let's see, we had another question. So the quality submission, can an EC report just MIPS measures or MIPS and QCDR measures? If you're using the registry, then you could do both if the registry has additional QCDR measures, but it would have to be out of the QCDR that you're pulling the data. So you should be entering data both here on the CMS portal and this is a question for you guys at the Southern New England PTN. They have an https://portal.sne-PTN.org. I'm not familiar with what that portal is.
Yes, this is Jill. You should be submitting data in both the CMS QPP portal and then quarterly in the SNE-PTN portal. The SNE-PTN quarterly reporting is separate from your MIPS reporting. So they're two different portals for two different products.
Perfect. Thank you. Oh, and I see Anna replied to that already. Thank you both. Once we upload the data and find out the score, is there a way to upload additional information to improve the score or delete and change the data timeline for a better score? Yeah, absolutely. So that was from Stephanie. That's a great question. Basically, you can upload, change your data, assuming you have data to support whatever you're changing it to, as much as you'd like between now and that March 31st deadline. There truly isn't a submit to CMS. Once the reporting window closes on March 31st, CMS will automatically evaluate whatever data is currently housed within the system. So if you want to tweak it to make it better, you can definitely update that as much as you would like. Just make sure whatever's in there as of March 31st is the most current and accurate and up-to-date as possible. Question, please provide recommendations for a multi-specialty practice with multiple EHRs, different certification years. The TIN also includes many hospital-based providers using the hospital EMR. This question is for ACI reporting only as we are part of a mixed APM. So great question. Hospital-based clinicians, assuming they are truly hospital-based as a designation from CMS, do not need to submit ACI data. They're an excluded group. In terms of using multiple EHRs, you would have to do a manual attestation, and you would have to select whatever seems the most appropriate for the measure set that you select. So if, let's say, I don't know how many EHRs you're using, let's say it's 4. 3 of those EHRs are 2014 certified and 1 is 2015. You would definitely want to select the 2017 transition measures because predominantly you're going off of 2014 certified technology. And then because you have multiple EHRs and multiple populations, you would need to manually aggregate the data for each of the measures that you're reporting on and then enter it manually into those manual attestation fields for the different measures. What happens if an improvement activity has different performance states? That's a great question. Yeah, so if you pick 4, I would say, let's see, I guess it depends on the range. So if you're selecting an improvement activity that maybe was at the beginning of the year and one that was at the end of the year, you might want to select the full year just to cover those 2 dates. But I'm not entirely sure as long as you pick at least a 90-day period that it matters all that much because CMS doesn't allow you to specify based on different activities. But again, this is where it's critical that you have supporting documentation for each of the activities that you're reporting on. So if it requires reports, processes, workflows, any sort of documentation that you have to support what you've done and the dates that you've done those different activities, you want to make sure you have that in a safe, secure location that should you get audited down the road, you can provide that data to CMS. Do files from the EHR get uploaded separately or as one file? You would be able to select the file for each of the performance categories to upload if you have different files. I'm not entirely sure what separately otherwise means. Can you please say slowly the type of file that can be uploaded for our EMR? It would be a QRDA, Quality Reporting Data Architecture Type 3, that you would need to be reporting on. That is the only file for an EHR that can be selected and counted. For the EIDM login, if they are an individual provider, do they need to be the one to create the login, or can it be another person in the practice?
It could be another person in the practice. You just need to have someone in that role type. So it could be whoever's managing your QPP submission, whether it's a quality manager or a front desk person. You just need to have someone in that role type.
Perfect, thank you. Alberta, any people on the phone before I continue in the chat?
No, not at this time.
Great, thank you. I have a question for the PowerPoint slides. Alberta or Morgan, do you guys mind providing the link to those?
Hi, Leila. We've already inserted it in the chat box.
Okay, perfect. Thank you. Question here, if you're reporting by claims, can you see this to where you stand on scoring? Unfortunately, no. Claims does not allow much transparency in terms of how you're performing. The only information you would have in terms of sort of monitoring your performance throughout your reporting period would be whatever data you keep in terms of those claims that are submitted. But unfortunately, there's no way to go back and say, oh, I'm performing at whatever rate and I've had these many patients in the various reporting populations. If you're reporting, if you choose PV physician quality and value programs, when in the CMS portal, you choose PV physician quality and reporting programs when in the CMS portal if you're part of an MSSP ACO shared savings program. Yes, it's all physician quality value programs. If you're in an ACO, is there an ACO view to show the ACI percentage at the ACO level? No, I do not believe so, unfortunately, but we have very limited access on the QIO and the PTN side of the house in terms of getting into the portal. So that might be a functionality for those of you that are identified as ACO administrators. But for everyone else, I don't believe you can actually see what your performance is.
Hi, I have another question. I was talking to the QPP help desk, and they said that we will also be able to see reports after the submissions as to how we did and potentially what our incentive could be. Have you heard that? And do you know how we will see any final reports or understand if we, went above the 70 benchmark, what our potential incentive might be? Or
yeah, absolutely.
Because of when I'm doing ATM.
Okay, so yeah, CMS should be releasing performance data. I wouldn't expect it though until sometime either later this summer of 2018 or the fall, similar to when the QRUR reports were released, so like September timeline, in terms of how you're performing and potentially what your incentive might be. But again, this is an all new reporting methodology, not just the portal, but MIPS in general. So I would say reports on performance might be delayed a bit.
Does that also mean that we don't know out of that pool of money where the incentives money is coming from, what it could potentially mean for our payment year in 2019?
Correct, because it's all dependent on who gets a penalty, where your incentive is coming from. So once that's all been calculated, how many individuals are getting penalties and what percentage of their Medicare payments that is, then that money can be divided upon all of the individuals that get positive payment adjustments, and then all of those who are above the 70 performance points and achieve the MIPS exceptional performer bonus, how that's getting divvied up.
If there are no other, if I can, I'd like to ask a question about how we're a single specialty group, and one of the things that we would like to do, we're still independent, is consider the APM track. What resources are available for us to go down that path? And does your organization assist with free consulting on that end?
So in terms of getting established as an APM, we don't typically, because that's a separate contractual agreement that you would set up with CMS. but you can go through the CMMI portal, which is the Centers for Medicare and Medicaid Innovation model or something to that effect, and that's who handles the various APM models. So you need to do some risk evaluation on whether you go the advanced APM route or the mixed APM route, and unfortunately we can't provide you with that because we don't have the calculation data in terms of where your claims would be and all of that CMS and the innovation model staff would be able to help you with.
Thank you.
Absolutely. Another question on, it sounds like you're saying QRDA 83. It's QRDA 3, as I mentioned, Quality Reporting Data Architecture 3 is the file. Are we eligible for only reporting 90 days or a full year? You can choose a single instance if you're trying to avoid the penalty. If you're reporting quality and can pull that from your EHR, all the way up to a full year. It's really up to you what amount of data you have, but 90 days is the smallest reporting period for advancing care information and improvement activities, up to a full year if you're able to pull that.
Got a question from the phone if it's open to questions.
Absolutely.
Just to confirm our understanding, if we're reporting for a mixed APM part of an ACO, and we have 2 TINs, and each TIN is a group, so we need to report either QRDA 3 or numerators and denominators for the group. Is that correct?
Yes.
Okay. All right. Just wanted to make sure.
Yeah, and it's whatever, if your EHR can provide you with that file, obviously uploading a file is a much faster route than entering the numerators and denominators. Some individuals prefer to go that route. It's really what works best for your organization.
Very well. Thank you.
Sure. Next question is, if you're submitting data as a group and uploading the QRDA 3 file, how would CMS know which clinicians' data are included as part of your group 10? So that's a great question. That's where it's really critical when you sign up for your EIDM account that you ensure that all of the data in PTOS is correct for your TIN, and that's where you associate all of your clinicians to the TIN and make sure that their MPIs are correct, because that's how CMS is affiliating your clinicians. You can also go on that main account dashboard page. When you click on the TIN, I didn't show you because, again, I have limited access. It would show you all of the clinicians that are affiliated with that TIN. Just as a word of warning, we have heard that there are some errors in how CMS is displaying that data. We've heard that there are clinicians that are duplicated within the TIN, clinicians that haven't been part of the TIN for years or maybe are deceased are included. So just know that you might not see exactly what you should be seeing. CMS is aware and working to resolve that. If you have questions and this issue persists beyond a couple of weeks from now, I say definitely get in touch with us because we need to let CMS know so that you can accurately report on who you need to report on. Will you be showing group submission as just individual? Tricia, the submission is exactly the same whether you submit for a group or individual. It's just that first screen. If you click individual, you select what category, or if you click group, and then you select what category. But otherwise, the screens are exactly the same. For improvement activities only reporting, is it just as testing with no upload? Yeah, absolutely. It's just a yes. You say, yes, I'm doing whatever I'm doing in the time frame. Currently, CMS is not requiring any files to be uploaded. If I'm an individual provider and I receive a QRDA file from my registry, so just a quick thing, it wouldn't be a QRDA 3 file from a registry, it would be the QPP format, so just make sure you're getting the correct data file from whomever you're working with. Can I submit that on my own behalf to CMS? Will CMS accept my submitting non-QPP measures on my own? I'm not entirely sure what you mean by submitting non-QPP measures on your own. If those are the qualified clinical data registry measures, then yes, assuming you get the right file format. Outside of that, you would have to pick measures that are within the program. Can improvement activities be more than 90 days or just use 90 days? They can definitely be more than 90 days. Some improvement activities require at least 6 months of data. So if it's an improvement activity that would require more data, you want to make sure that you report the appropriate time frame for that. All right, long question. We have 3 doctors in our practice and submit the quality portion on claims as individuals, the advancing care information as individuals, and the optometry improvement activities as a group. Can we do this? No, you cannot do this. In terms of the improvement activities, they would also have to be reported as individuals, because you can't, if you report one category as a group, you must report all categories as a group. So because you're already doing claims for quality, that basically dictates that for improvement activities and advancing care information, you would also be reporting as individuals, because you can't go back and forth between individual and group. So if you can just adjust those optometry improvement activities to be individual, you would be all set. Is there somebody on the phone who would like to ask a question?
If you'd like to ask a question, please press #6 to unmute your line.
Hi, I have a question.
Sure.
Will these screenshots, will this webinar be available, will it be emailed to us so that we have the information that was on the screen? Or can it be accessed somewhere if we didn't?
In the chat, and I will add it at the end of the question and answer session, there is a link that will bring you to today's slides. And also in a few days, the recording and the transcript will be available.
Okay, thank you.
Jill, I have a question for you guys. Our organization has a security official. I'm trying to sign up as a PQRS submitter. Do I have to go through the entire application process in order for the security official to approve my request?
Yes, you do have to go through an application process in order for the security official to approve your request. So when you sign into the EIDM account, there is a process called requesting a provider role. You have to enter some personal information in order to create yourself an account.
Excellent, thank you. Another question, can you please tell us again the file types that can be uploaded? So if you're using a certified electronic health record, that is a QRDA3 file, and if you're using a registry or qualified clinical data registry, that would be a QPP format file. Those are the only 2 that are accepted in the portal. Is there an extra bonus for submitting through the Excel upload versus the manual direct into the web interface? We have submitted through the portal. Oops, sorry, I scrolled down too far. You can't submit an Excel. That's not acceptable. Again, it has to be a QRDA3 file or a QPP format file. We're not talking about the web interface today. That's a separate process that goes through ACOs or alternative payment models. So kind of different processes, and we're just handling the portal today. But you have to have a file format other than Excel. How are excluded providers included in the final percent for ACOs? We have 11 excluded providers that receive CMS exclusion letters. Do we still collect ACI data on these providers? So this is an interesting question, and I think I would need some additional information from this individual. If it's exclusion letters based on low volume thresholds, so that these individuals didn't meet the $30,000 in Medicare Part B claims annually, or see 100 Medicare patients annually, then unfortunately it doesn't apply, and they're not excluded, because ACOs are seen as groups, and so within a group, the group has to meet the 30,000 and 100. It's not by an individual anymore. So if it's based on low volume exclusion, those individuals would need to be included. However, if those individuals are in the excluded populations for advancing care information, which are hospital-based clinicians, non-patient-facing clinicians, physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists, then they would not need to submit advancing care information data unless you could easily pull those reports and their performance helped your organization. But there's really two pieces to that, and I'm not sure exactly which exclusion you're referring to, but if it's low volume, then they would have to be included in your ACO's percentage. Next question, is the new system designed to support organizations that submit data under the same TIN for both an APM or a single participant under the single participant TIN next-gen ACO and group MIPS reporting? So, great question. We actually have a question out to CMS on this. Continuing with the questions, 80% of our MIPS eligible providers are under our ACO, while 20% still need to do MIPS. My colleague, who's supposed to be the MIPS security official, has not been able to locate our TIN in that part of the EIDM portal. The ACO security official has been able to locate our TIN under the APM portal. So that's a great question, because the way the portal is set up is you can obviously either select to report as a group or as an individual. In the scenario that you mentioned with TIN potentially being split between individuals within the TIN being part of the ACO, whether it's a MIPS APM or a next-gen APM or whatever the case might be, any other APM, and then some individuals outside of the APM, if perhaps they joined after that third snapshot date, or whatever the case is, there isn't really good functionality in place to allow for separate reporting. So I would just ask that you be patient. We're asking CMS on how organizations should best report the data, because you might actually want two separate time frames, but at the current time you really can only select one. So hang tight. I know which organization you're from, so I'll be sure to get in touch with you and make sure that you have the information that you need. So more to come on that. And if your organization is in that same bucket, please let us know, because we want to make sure that you're accurately reporting and you get credit for all of your clinicians, whether they're reporting under the APM or reporting to MIPS.
I have another question. Can you just go over again the exclusions or what's required? Because we have one non-patient facing provider in our group.
Okay.
And we do have physician's assistants. So I'd just like to get a little more clarity on those three measures and what has to be done and how it's done.
Yeah, so clinicians that are either considered non-patient facing, hospital-based, physician assistants, nurse practitioners, that group, they're not required to report advancing care information. So if you're able to report data and just pull them out of your population, you're more than welcome to do that. If you can't, and their performance, let's say, is not where you'd expect it to be, it's all dependent, I guess, on your EHR and how well you can manipulate the data to perform whatever measures you want to show. So those clinicians that are excluded, you don't have to exclude them if you don't want. If their performance is high enough that you want to include them, or you can't exclude them from your reports, you're more than welcome to pull them in. It's really just, they don't absolutely have to be part of your reports.
And then with improvement activities?
Everyone is basically eligible for improvement activities and quality. There's no exclusions for those two categories based on the provider type that you might be.
Thank you.
Absolutely. So next question is, we submit our PQRS codes via claims. I was advised by our EHR that we should submit via our registry, AOAM, or I'm not sure which one that is, as well, and CMS takes the best score since the registry will report on all patients and claims only reports on Medicare patients. Is that true? Yeah, so you could certainly report via claims if you have a process set up that automatically submits the claim codes based on the patients that you see, and you don't need to worry about any additional work. You could do that. If you didn't report anything via a registry, the claims would be your backup. But I would say if you're reporting via registry, submit that data to CMS to make sure that you're covered. But CMS will take the best of the method that you select. But in order to reduce your administrative burden. It's easiest if you pick one reporting method. Oops, my computer jumped a little. Will there be a report from the Southern New England PTN that we'll be able to upload to CMS?
If this is pertaining to improvement activities or TCPI participation, you will have to sign into the portal and attest, as Leila went through in this presentation, to that improvement activity. So we will not be providing a report where you will have to go and manually attest to that.
Great, thank you. What happens if a practice submits via CMS Portal and via a registry? Is there a responsibility of the registry or submitter to only submit data via one mechanism? So, yes, theoretically you'd want to know who is submitting data on your behalf to make sure that it isn't in contradiction to whatever else you might be reporting. Again, if you submit via multiple methods, CMS would take the best of the methods, but I would be very cautious with submitting multiple times. It's not necessarily the best process to be under, just because if there's any sort of contradiction in reports or any variation, I'll be 100% honest, you do set yourself up for audit potential, because obviously your reports don't line up and the data contradicts itself. So just be cautious. If you have a registry that's submitting on your behalf, I'm not entirely sure why you want to report via the portal, because you already have somebody submitting data on your behalf, but you need to make sure that you cover your bases with the different performance categories and submission based on what's available or not available via your chosen submission method. If I am an individual provider and I receive a QRD3 file, I already answered that question. If a registry is submitting the quality measures, will we be able to see the data in the QPP portal? That's a great question. I don't believe so. I believe the data in the portal is whatever is submitted by you or someone within your organization.
Leila, I think actually if you are able to, because you would have to give the registry through the EIDM account access to submit your data, and then you should be able to see it.
Oh, even better. So yeah, so if they have access, then theoretically you would be able to see it. Okay. I wanted to report for a full year, but I was unable to put information into the Southern New England portal for the first quarter of 2017. Can you help me get the information in the first quarter for the diabetic eye care?
This is just to reiterate that the SNE-PTN portal for the quarterly measures is separate than the QPP data submission portal. But if you want to reach out to us after this presentation, we can help you get the diabetes eye exam measure into the SNE-PTN portal.
Excellent. How do you report on mid-level practices and walk-in clinics who operate under the hospital PIN but different EHRs and practices? Pam, I'd say that's a question kind of outside the portal. You need to get data for those clinicians, and it would really depend on how they're classified. It really depends on many factors. So if you want to contact us, our contact information is on the next slide, which actually I'll make available now. Feel free to send us an email with your specific question, but unfortunately that's sort of outside of the purview of this webinar. What is the best option for reporting on providers that join the group in October 2017 or later? So less than 90-day reporting is available and do not appear on the connected clinicians list. Again, that's sort of outside of the purpose of this webinar. If you're looking to upload data for the portal, you can select less than 90 days and get limited performance points with those clinicians. Again, you only have to submit the minimum amount of data in order to avoid a penalty, so I'm not sure if those clinicians are part of an ACO or APM or if they're just joining a practice. It really depends on a multitude of factors and what your goals are. So, Claudia, if you want to send us an email, we're happy to work through that with you, but it really depends on a couple things. Oh, someone's banging around. Can you please mute yourself? To clarify, there's no submission button once we're satisfied with our performance. Yes, that is correct. There's no submission. Once your data has been entered, CMS will take whatever performance is currently in the system as of March 31st. If we submit quality data, GPRO is actually the CMS web interface now. Do all categories need to be submitted as a group, or can we do ACI as an individual? So, Trish, I guess that depends on a couple things. Are you referring to being an ACO administrator, or are you a practice within an ACO? And if you're a practice within an ACO, are you a single clinician practice, or do you have multiple clinicians? I don't know if you're still on the call.
Remember to hit #6 to unmute yourself.
Can you hear us?
Yep.
Oh, there we go. So I believe you're an ACO administrator. So they're going to be doing a GPRO submission, but the ACI submission will be at an individual level. We're hoping.
So the ACI thing, it can be either as a group. What kind of ACO are you part of?
We're track 1, APM track 1.
Okay, so you won't be attempting to advance these information as individuals. It's required to be done by your TIN. So the practice TIN, not the ACO TIN, will have to submit its aggregate data on ACI.
So at a group.
Yeah, a group. So let's say there's 15 groups that make up the whole ACO. Each of those groups has to submit ACI by your TIN.
By their TIN. That will roll up
Correct.
to our ACO TIN.
You got it.
Okay. So we do have to aggregate the data. We can't submit data at an individual level.
Unfortunately, no. For Medicare True Savings APMs, you have to do it as a TIN.
Yay! Okay.
A couple last minutes, and then we'll be finishing up the call. Someone asked about QCDRs. Unfortunately, that's not part of the webinar today. If you have specific questions on QCDRs, you can reach out to us. I am an individual provider excluded due to low volume. I'm part of an MIPS ACO, so I still need to submit ACI data. If you are part of the ACO and not one of those excluded clinician types that I mentioned, so hospital-based, non-patient-facing, physician assistants, nurse practitioners, clinical nurse specialists, or registered clinical registered nurse anesthetist, yes, you still need to submit ACI data. Would we need to include providers who qualify for a hardship under the 50% rule? I'm not sure what the 50% rule is. Is Brenda still on the call?
Yes, this is Brenda.
Hi, Brenda.
Hi. The question regarding the 50% rule is originally when all of this was set up years ago, it was determined that if a provider did not see 50% of their patients on a back then it was a meaningful use certified EMR, then they were eligible for hardship.
Yeah, so that's no longer a hardship.
Hardship.
How many clinicians do you have, and are they mostly on paper? What's the...
So we're a group of nephrologists.
Okay.
And so they see patients at the dialysis unit. They don't have any say over the EMR that they use at the dialysis unit. And the dialysis unit EMR is not certified.
Okay. Do they have any access to a certified EHR?
In the office they do, but they see more of their patients in the dialysis unit rather than in the office?
They would still, because the dialysis unit is not certified, they would report on only the data from the certified system, so it would just be whatever they can pull from the office.
Okay, so they...
Ideally, you'd want, oh, sorry, go ahead.
Well, they did receive a hardship notification, but we would still report for them?
Well, it depends on what the hardship is. There were 2 hardships that could be applied for, so I'd want to just make sure you have the correct NIPS hardship and not the 2017 EHR Incentive Program hardship, because there were 2.
Okay.
If you want to send me an email, we can review the letter together. I just want to make sure, without seeing it, I can't say for sure.
Okay. Great, thank you.
We can work through that with you. Absolutely. It looks like we have 2 more questions. I know we're just a little over time, but I want to make sure we get to those, so you're more than welcome to stay on the line if you can. If we're reporting under an APM with BIDCO, we still have to report our API data, and we have to do this under individual, correct? Yes. You can do it under individual or as a group TIN. BIDCO is an advanced APN, which means that they can actually scratch that for Medicare Insurance Savings Track 3, so no, you're reporting it at the TIN level, because Medicare Insurance Savings programs have to report at the TIN. I'm new to the office. If codes are being submitted through claims, does that automatically mean that we will have to report other information under individual as opposed to group? Yes, that is correct. If you're using claims for quality, you would have to be reporting as individuals throughout the program. For ACI measures, we are planning to submit data for our providers individually on the QPP portal. They are part of an ACO. Do we submit via QPP or the CMS web interface? Depending on the size of your practice, if the practice is over 25 eligible clinicians, you would be able to use the web interface. If your practice is less than 25, you would need to use the portal or other mechanism directly through your EHR, whatever the case might be. We submit via CMS and not the registry. Can we still attest to participating in a registry in order to receive the bonus points? Yeah, that's a great question. Depending on the registry, assuming it's a qualified registry, maybe for a condition or whatever your specialty might be, absolutely. As long as you're submitting data to them in terms of conditions, patients, whatever the case might be, you could still take credit for that registry utilization. As an ACO on track 1, we do GPRO, CMS web interface now. Submission for our practices, does this mean the practices will have to report ACI data as a group? Yes. If you're an ACO, Medicare Insurance Savings Track 1, you still need to report data on advancing care information as your group TIN. Can we submit more than 6 quality measures and CMS will select the highest? Yeah, great question. Absolutely. You can submit as many as you'd like. CMS will take the highest 6. The nice thing about reporting on more than 6, if you use the electronic reporting mechanism, so the QRDA3 file, you'll actually get some bonus points for some of those additional measures. Okay, I think I'm down to 2 of 3 last questions. Is there any way to tell if a newly hired provider after 10/2017 has had their NIPS reporting done by a previous 10 in 2017? Ooh, great question. I don't believe so. I think it's similar to meaningful use where there really isn't a great mechanism to know if data's already been submitted. The only thing I could say is that since we're so early in the reporting period, that there's a good chance that no data has been submitted for this clinician yet. So you might want to check with their previous organization to see what they're planning on doing. Is the same for track 3. I'm not sure what that's in reference to. And a solo, that just says, and a solo would submit by that TIN individually for ACI. If you're a solo clinician, yes, you're reporting individually or by your TIN. Frankly, it doesn't really matter because usually your TIN is affiliated with your social or your MPI because you're a solo practitioner. Should a provider be in a Medicare Insurance Savings plan that has potential to qualify for an APM status but ends up not qualifying when they announce sometime in Q3, will the quality submission for MSSP satisfy the mixed quality measures? I'm not sure I follow. So if a provider is part of a Medicare Insurance Savings track that doesn't qualify as an APM, I'm assuming you're referring to a track 2 or 3 APM because they're the only ones that would qualify. Otherwise, Medicare Insurance Savings Track 1 is a mixed APM. If you submit data through the CMS web interface, that would qualify for your quality measures. Regardless, I'm just not sure what MSSP you're talking about. It depends a little on that. Can you explain the difference between the web interface and the portal? The web interface is a tool available for accountable care organizations or alternative payment models for data submission. It looks at attributed patients, and you have to submit data on 248 consecutive patients. There's a group of 15 pre-selected quality measures. If you're in a practice of greater than 25 eligible clinicians, you also have the opportunity back in June to register to use the web interface, but if you didn't register, unfortunately, is not an option for submission. The portal, the CMS portal, is what we just reviewed, where you can go in and manually attest to the advancing care information and improvement activities, as well as submit report data for quality advancing care information and improvement activities. I think we got through everyone's questions. Final check, we're 7 minutes over, but if you have any last remaining questions, please let us know. And if you would like to send us an email, you may also do that. We're happy to help you out.
Okay, thanks everybody for a great discussion. We have a few announcements before we end today's call. As a reminder, we're now on social media, so visit us on Facebook, LinkedIn, and YouTube. When you close out of the webinar today, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. If you don't have time to fill out the evaluation right now, or you're currently sharing a computer with someone else, you'll receive an email tomorrow with the link to the evaluation, as well as a link to the event page on our website. And the PowerPoint presentation that was in your day of details email will be posted on the website within the next few business days. Recording or in the transcript of this webinar will also be added to the web page. Thank you again for attending and have a great day.
Thank you, everyone. Take care.